There are some 800,000 strokes each year in the United States, a third of them deadly. And here in Arkansas, where it's known as the stroke belt, we've been at a higher rate.
And when it comes to treating strokes, every second counts, of course. KARK4's Wendy Suarez takes us in depth on technology here in Arkansas that is helping to save lives.
Usually when we think about stroke patients, an older person comes to mind, but one young Searcy woman's story and some video of her actually having a stroke will make you think twice. She's young and energetic, a perfect fit to teach elementary school.
And all sentences begin with a capital letter.
But at 25 years old, Tisha Covington suffered a stroke. It happened one morning while getting ready for work. Her vision became blurred.
I knew right then something was wrong, and over the next probably 10 seconds, I started getting really weak on the right side of my body and kind of fell into the door frame.
Okay, what is she saying?
This is actual video of Covington after her husband rushed her to White County Medical Center in Searcy. By then, she was experiencing even more symptoms.
The pull of my eyes, nose, mouth, slurred speech, and I was kind of starting to talk funny.
They swim.
Doctors 54 miles away in Little Rock were able to see this video in real time and help treat Covington. The telemedicine program is called Arkansas Saves, which stands for Stroke Assistance Through Virtual Emergency Support. Based out of UAMS, it connects specialists with ER doctors at 22 smaller hospitals all across the state.
We do that with live video and audio connection. We can see patients live at the same time they present to the outside hospital. I go online immediately and I can see the patient, talk to the patient live.
In this case, UAMS doctors diagnosed Covington with an ischemic stroke and gave the okay to give life-saving medicine called TPA, a powerful blood thinner that melts the clot that's clogging the brain vessel. TPA doubles a patient's chance of improving, but it has to be given quickly.
Time is brain here. Time is very precious. We only have a very narrow window of opportunity during which you can intervene. That's just 4.5 hours.
Having a doctor that could pretty much instantly look at me and say, yes, this is what needs to be done, and played a big role in saving my life.
After getting TPA, Covington was transferred to UAMS for further treatment. Now she's back in the classroom and feeling great. But what caused a 25-year-old to suffer a stroke? After testing ruled out a genetic cause, her doctors believe her birth control pills are most likely to blame.
It's just a fluke, I guess.
She has quick reaction and high-tech medicine to thank for her recovery. She wants others to hear her story so that they may share the same positive outcome. Since Arkansas Saves began 2 years ago, 75 patients have been able to get that life-saving medication, TPA. Now remember, symptoms of stroke come on immediately, and if you have them, you need to get to the nearest hospital. Important to note here, because time is of the essence, doctors actually recommend you take an ambulance there. That way you'll be seen by doctors more quickly. Back to you.
All right, Wendy, thank you.
First thing to do would be call 911.